You're watching Midday Live on TV3. I am Wendy Laya. Headlines for this afternoon. Doctors and public hospitals start strike by not attending to outpatient cases. We have some of our reporters on the ground in Accra and also in the Ashanti region to give us an update on this specific strike issue that has to do with the health sector. On the frying front, World Health Organization calls for calm over new bird flu strain H7N9, saying human infections of the virus are isolated and may remain so. So I've got the details of these stories and many more lined up for this afternoon. But remember, you can always get interactive on Facebook and Twitter. It's News on TV3 or short code 1734. Details coming up shortly. Let's look at our stories now. Students of Kwame Nkrumah University of Science and Technology have appealed to government to address the concerns of teachers to enable the lecturers get back to the lecture hall. Speaking in an interview with TV3, some of the students said the strike action, if not checked, will cause an extension of the semester. Here's a report by Benjamin Edu. But before we take that very story, government has again appealed to the University Teachers Association of Ghana to call off their strike and return to the lecture halls, since government has agreed to pay according to the National Labour Commission's directive. Now, a statement signed by the Minister of Information and Media Relations, Mahama Ayariga, said university teachers have been fully paid their monthly salaries and other allowances for every month that they have worked for in 2013. It added in 2012 they were paid their salaries and other benefits except the market premium, which is an allowance that was in dispute despite its subject matter before the Labour Commission. And more on Midday Live, the President and all ministers and deputy ministers of the National Democratic Congress NDC who served in various ministerial and deputy ministerial positions, including presidential staffers, from 7 January 2009 to 7 January 2013, have not been paid their ex gratia from that period. That is an information in a statement signed by the Minister of Information and Media Relations, Mahama Ayariga. On the phone line this afternoon is Samuel Ofosu-Ampofo, a former Minister for Local Government and Rural Development, to talk more on that very issue that has to do with ex gratia paid to ministers and deputy ministers of the National Democratic Congress. Good afternoon. Thanks for your time, sir.
Good afternoon.
Hello, sir. Are you on the line?
Yeah, I can hear you. Good afternoon.
Well, we're trying hard to speak to Samuel Ofosu-Ampofo, former Minister, Local Government and Rural Development. Hello, are you on the line, sir? Good afternoon.
Yes, I'm on the line. Good afternoon. I can hear you.
Okay. Well, now we have a statement from the Minister of Information, which is stating that deputy ministers or ministers who served under the National Democratic Congress from January 7, 2009 to January 7, 2012 have not been paid their ex gratia. Have you received yours?
I haven't received anything, and I have not been given any notification of any money paid into my account.
But definitely you will be paid.
Well, that's a constitutional requirement. You know, once it is required that when you serve your full tenure of office and you are no longer a minister, you are entitled to some amount of money to enable you to resettle. I am eagerly expecting that what is due me will be paid at the appropriate time.
Okay, but have you had hints of any information of when you will, or have you been communicated to as to when you will receive your money?
No, there hasn't been any communication at all. This hasn't come to my attention, and nobody has called me. And to the best of my knowledge, I don't think that any of our colleagues who served during the period under review have received anything of that nature.
All right, well, thank you very much, Honorable Samuel Ofosu-Ampofo. He was a former local government minister and also a minister for rural development, but we're trying our best to reach the Minister of Information, Mahama Yaiga, to tell us more on that very press statement that the ministry has released on that issue that has to do with ex gratia payments. You still watching Midday Live on TV3. Remember, you can get interactive on Facebook and Twitter. It's News on TV3 or short code 1734. Like I did say earlier on the doctor strike, we're trying to get our reporters across the country to give us updates on what really is happening at hospitals where they are in their very regions. It's still Midday Live on TV3. Now, authorities of Ija MA Primary and JHS want support to stop the shift system in their school. They're calling on government to speed up work on a 6-unit classroom block meant to bring an end to the shift system. It's a report by Ibrahim Abubakar.
Established in the late 80s, Ija Primary and JHS is the only public school serving the Ija community and its environs. With an annual increase in enrollment, student population has moved from an initial 50 to about 1,000. The increase in enrollment compels school authorities to introduce the shift system of education some years back. There is congestion in classrooms due to increase in enrollment. While some sit in threes on a dual desk, others have to sit on the floor to learn. To abolish the shift system of education in all public schools, government began the construction of a 6-unit classroom block in 2009, but this project has been halted. Isaac Benishan is the PTA chairman of the school.
Most of the classes are full without teachers. Now, the government thought it twice to build a school for us. 4 years now, we didn't have anything. No roofing, nothing.
He pleaded with the government to speed up work on the project.
The paramount chief of the New Job and Traditional Council, Dasiba Professor Oti Boateng, says the changing demographic transition of the country demands a new aging policy. He observed most pensioners cannot make ends meet.
The 75-year former government statistician said it was imperative a proactive policy is put in place.
Nations after nations are changing their pension age to 65. Some are going, the Scandinavian countries are changing to 67 years as a pension age. Now, if you stick at 60 years, fairly soon there will be too many people age and getting out of the social security scheme.
He warned of collapse of the social system.
The pensionable age of 60 can no longer hold. So we got to discuss this at the national level, come out with the appropriate age so that what goes to the kitty, there will be more for the people who are aged. People can work up to the age 65. So why should you pension them even at 75? I was working. Why can't 65 years old work?
The Eastern Regional Minister, Helen Ajoin-Toso, commended him for his several years of exemplary leadership and pledged a commitment to work in close collaboration. The event marked his Diamond Jubilee.
In other news, guinea fowl farming will soon be the main focus of alleviating poverty in the northern, upper east and upper west regions of Ghana. The chief executive officer of SADA, Alhaji Albert Idi, disclosed this at a meeting with the Upper East Regional Guinea Fowl Farmers Association in Bologatanga in the Upper East region to deliberate on the industry matters. We have this report by Ibrahim Tanko, but while we're still trying to get you that very story. It's still Midday Live on TV3. Remember, like I do tell you, or did say earlier on, get interactive on Facebook, News on TV3 or short code 1734. The doctors in public hospitals have started their strike by not attending to our patients' cases. If you're around the hospital, you can tell us your experience there, or if you have any information on the strike action, you can go on Facebook and just type it there so we can read it out to other viewers also. But we look at some other stories. Executive Director of the Lepers Aid Committee, Reverend Father Andrew Campbell, has appealed to government to increase the feeding fee of the cured lepers, which is currently 85 pesos a day. He said an increment will improve the living standard of the cured lepers across the country.
Leprosy is a chronic disease caused by a bacteria, Mycobacterium leprae. Symptoms include muscle weakness, skin stiffness, skin rashes, and eye problems, and can take as long as 20 years for symptoms to appear. Leprosy can be transmitted via droplets from the nose and mouth during close and frequent contacts with untreated cases. Leprosy mainly affects the skin and nerves, and if left untreated, can cause permanent damage to the skin, nerves, limbs, and eyes. In Ghana, the Weija Leprosarium in the Gan West district, established in 1950, currently has 30 cured inmates. Inmates receive only 85 pesos feeding fee for a day, and this is supplemented by donations from philanthropists and NGOs. However, though they have been cured, these inmates have been abandoned by family members due to the stigma associated with physical deformities suffered by patients.
We had the Queen Mother about a year or 2 years ago, the Queen Mother, and we didn't know she was a Queen Mother, and usually we buried them on the next day after their death. But this Queen Mother was taken to her hometown. It was a whole month before they buried her. You know, why wait until they die before you give them this dignity? It's easy to put your hand in your pocket and say, here's 10 CDs for you. That's very easy. But to spend time with them, to sit with them, to talk with them. And this is exactly what Christ did. He went out and made them feel happy. And so I think society has to change. And we want the government, 85 pesos a day. What's 85 pesos? 85 pesos will not take care of anybody in a day. And thanks to all the generosity of people like the Word Miracle Church.
We do apologize for the poor quality of sound on that very story. But the births and deaths registry recorded 426,444 births in 2012, 556,403 short of the targeted 982,844 registrations. Now, with persons in most districts, the registry's coverage increased to 65% in 2012 from 17 in 2012. The registry is housed in a wooden structure, and it could lose all of its documentation, including those dating as far back as 1912. I do have in the studio this afternoon with me Reverend Kingsley Asari, who is a principal assistant registrar at the Births and Deaths Registry. Good afternoon. Thanks for your time.
Good afternoon.
What accounted for the shortfall of the registration?
It has been a combination of factors. First and foremost is the fact that we are perennially faced with shortage of registration material. Somewhere along the middle of the year, we ran out of birth certificates, and it was a problem that really contributed to our inability to hit our estimated targets. At the same time, we have had this long-standing issue of inaccessibility to registration services, especially in our rural areas. We are operating with about a little bit over 314 or 50 staff who are supposed to actually service 25 million people. All things being equal, we should be able to assign one registration officer or registration center to every 5,000 people in the population. And granted that we are close to 25 million, it means that we should be operating from not less than 5,000 registration points across the length and breadth of the country. But we are operating from 370 registration points. So it means then that there is that shortfall already, and staff would have to do extra work to make sure that they reach out to people with births who have encountered births or deaths. Coupled with this is the long-standing issue of lack of absence of logistics. I mean, if we can't get the people to come to us, that means we have to go to them and get the information. But we have difficulty with mobility. We have difficulty in accessing certain areas that are cut off, especially in certain parts of the year. All these and other factors have contributed to our inability to meet our stated targets.
Now, then it all boils down to funding.
Funding is
another issue altogether.
Yes, one big issue.
It's another issue, but it's a big issue for your outfit.
It's a very big one, because if you go out there to create awareness and tell people that they need to register their events, and then they come and want to register and you don't have the facilities, then it means that you are actually not living up to your billing.
Okay.
And that is a crucial thing for us. We also want to overcome the problem of, let me use this word advisedly, ignorance on the part of the general public. Many people do not know that they need to register births and deaths, especially for deaths. People marry to bury their deceased anyway, and only remember to come for a registration when there is a need for them to apply for some benefits or some social security claims.
But I'll hold on the funding issue and still get back to the various points you did give early on. You're talking about people, ignorance in quotes, on the part of the public, but would you say education has gone down well with the public?
Education, we have done a little bit, but I must confess that it is not the maximum. We could do more. It's still because we need to get the capacity to be able to devolve messages to the community level. And a few occasions we have been able to access the media, the radio, the TV, but we think we should be able to do community-to-community derbers, mobile registrations, and community contacts, so people understand and appreciate the issue of vital registration, or sole registration for that matter, in this country. The appreciation has not gone down well with our people. People will wait until there's a pressing need for a birth certificate before they rush to come and register. But we need to gather the information as and when the events occur, because ultimately we are going to use this information for planning. And because we are not planning based on facts and figures, we are always caught napping when there is any
okay, so if I understand you clearly, some of these challenges also that had to do with the shortfall was lack of enough supporting staff to do what you have to do.
Yes.
But aside that, how long does it take one to do registration for his or her child?
Yeah, there are two categories of registration. Let me talk about the regular registration, which we consider the normal thing. Everybody's birth is supposed to be registered before you are age 1. So within 12 months, it is the parent's responsibility to report the event for registration. And all that we will need at that stage is a weighing card or proof of birth from the facility where the event occurred. If you walked into any office with the requisite requirements, the birth certificate, the weighing card, within a question of 30 minutes, you should be walking out with your birth certificate. Granted that the forms are there, the certificates are well in stock. 30 minutes, it's done.
And how much do you charge?
It is free up to 12 months.
Free up to 12 months.
Yes. But after 12 months, then a penalty is actually imposed. The issue is we are trying to encourage or motivate parents to register the events early enough, because we need to give annual statistics to feed into annual development planning and policy formulation. So if it's beyond 1 year, then it means we are late on our data already. So we are trying to motivate people by making it free for parents to report the events in good time.
And what's the penalty?
After 12 months, you pay a penalty of 10 Ghana cedis.
Okay.
Then after 5 years, you pay a penalty of 20 Ghana cedis. Okay. But that is not everything. After you pay that penalty for late registration, you are supposed to also make declarations from the court, an affidavit, and a few things to support it. And that one also comes with a certain amount of financial outlay. So, granted that you put all that one together, you'll be spending between the 20 Ghana cedis and 50 Ghana cedis to get a late registration done. Okay. That is why we want to encourage people to avoid late registration and register before 12 months. Once you did that, we now have a central database which we have created, and if there's a need for you to apply for a certified copy, you pay 5 cedis and you get your certified copy. So
wouldn't you, or would you say that the penalty and everything that has to do with the delay has also contributed to people not coming forward to register, even though they know they're late?
Yeah, in certain situations, yes, because people can't afford it. If you go down to the rural areas, if you ask anybody to even pay 1 cedi, it's a big deal. So that has scared other people from thinking that because they need to make payments which they don't have, then they won't register at all. And that is unfortunate, because in actual fact, if you registered before a certain period, you didn't pay anything at all. But everybody has the wrong perception that there is a charge. Let me be quick to also add that sometimes we have human relation difficulties. We have staff or volunteers who we are using in the fields who are also adding on to our problems. They go out there and take illegal monies from some of these unsuspecting people in the public. And we think with proper education, when people know that they can access the service for free within a certain time frame, it will help to address. That is why we want to step up public education and the awareness creation.
But one main thing that has to do with education now, is there any rollout plan for education to prevent most of these things from happening?
Yes, we have started some processes. For instance, for every 1st September, we have held births and deaths registration day celebrations where we have highlighted education on civil registration of births and deaths. We actually are taking the program down to the communities, into the rural areas where we think the information is most needed. So we are rolling out a mobile registration session and community population registration schemes. Embedded in these programs are community debates and education seminars where we take advantage to interact with people at that level, and then we answer all questions and maybe tell them what they need to know about registration and the strings attached to birth registration. And
another major issue has to do with computerization. Are you still registering persons on papers?
We are doing part manual and part computerization. At the basic level, at the community level, we still have to take information on a questionnaire. When the questionnaires are completed, then they are forwarded to the district registration center where they are collated. And then they are also forwarded to the regional registration offices where we now have a computer presence. So at that stage, the information is scanned and then passed into the automation system. It is our vision that we'll be able to devolve our computerization to the districts.
How soon?
It's in the process. We are in the process of automating the last region, which is Upper East region. Once we finish the Upper East region, then now we are moving to the districts. And it still boils down to a question of support and funding. So we are trying to get support from partners. And this is where UNICEF, Plan Ghana have played a very important role. They have actually been behind the success of our automation.
And before I let you go, I want to find out how you hope to generate enough money, because every time we go around and in the end, it boils down to funding.
It is not that we don't generate enough money, we do. But it's just the legislation or the protocols under which we operate actually dictate that every single person that we generate has to go into the consolidated fund. So what we are doing is we are talking to the Ministry of Finance to actually allow us to retain a certain percentage of what we generate to actually fund our operations. Because it's unfortunate that we take all that money. Last year, for instance, we did close to 4 million Ghana cedis. And come to think of it, that having collected all that money, we still have run short of registration material because we can't use part of the money to even service our own operations.
But how soon is the negotiations with it?
We're still talking with the ministry or the responsible agency to ensure that we are added on to the MDAs who have retention. If that goes through, then I believe you will see a changed births and deaths registry.
Probably before the year ends.
It is our hope.
All right. Well, thank you very much. Reverend Kingsley Asari Ado is a Principal Assistant Registrar, Births and Deaths Registry, and we're looking at everything that has to do with births and deaths region. We're doing our best to speak to one of our Ashanti regional correspondents, William Evantinkum, who has been out and about at some government hospitals to give us an update and give us real facts on what is happening at the various government hospitals in the Ashanti region. But remember, you can get interactive on Facebook and Twitter, News on TV3 or short code 1734. If you've been to a government hospital, tell us what's happening there, share your experience with us, or someone you know who has an experience at the hospital probably this morning. Tell us what you've seen or heard. You can share it on Facebook and Twitter, News on TV3 or short code 1734. I'm told I have William Evantinkum on the phone line now. Hello, Evans.
Hello, Wendy.
And now, where have you been to, and what is the situation there?
Well, currently we are live from the Confanosi Teaching Hospital, and as you can see, precisely from the polyclinic outpatient department, and as you can see, the whole place looks deserted. I'm told earlier that there were a chunk of patients here who are actually trooped from various places across the northern sector to come here to access medical care, but to no avail because the doctors are actually on strike, and it's affecting health delivery here. But let me give you a bit of statistics here. Here at the Confanosi Teaching Hospital, we have 2 main OPDs, and we have the specialists, and then that of the primary OPDs. Every year, the 2 OPDs report not less than 400,000 attendants. That's 400 cases are recorded yearly in this very OPD. Let's look at daily basis. On daily basis, each day, each OPD reports, or the 2 OPDs record not less than 1,100 cases, with 400 doctors. So in this, if all 400 doctors at Confanosi Teaching Hospital are laying down their tools against new patients or OPD cases, means we are going to have, a 1,100 patients who will be denied medical attention here. And if you could multiply that by the number of days these doctors are going to remain on site, I think it's quite pathetic. Initially, we were trying to reach or speak to the chairman of the GMA here, but he's actually in a meeting. So we couldn't get anybody to speak to, but a couple of the patients that we spoke to, they have actually expressed.
Well, we did hear from Ashanti Regional Correspondent William Evans Income on what is happening in relation to the doctor strike in the Ashanti region. You're speaking to us from the Confanosi Teaching Hospital, but you can also share your experience with us wherever you've been to, whichever government hospital you have been to. Tell us your experience. Facebook and Twitter, News on TV3, or short code 1734. You're still watching Midday Live.
Yesterday at the Babayara Sports Stadium, not too good news. Literally many fufu sports and Kumasi. Following the Asante Kotoko's failure to qualify to the round of 16 in the CAF Champions League. So 16 teams have qualified so far, and no Ghanaian representation in this season's CAF Champions League. I've been joined in the studio this afternoon. Jerome Autry, as usual, joins us. He's a sports journalist with Kotoko Express, and we're going to be looking at the way forward for Asante Kotoko. Jerome, not too good news yesterday.
Not at all. We were very disappointed, and that is not what we expected. But in football, if you are to do what you are supposed to do and you don't do it, that is what happens. I was very disappointed, but not too surprised, because I knew it was going to be difficult. And at the time that we were throwing chances away, particularly when the Algerians had scored, it was always going to be difficult for us to come back.
Why are fans calling for the exit of Coach Didi Dramani so soon? I think he's... I don't know why they're blaming it on Didi.
I think it's natural. These are supporters who always want the teams to win, and if the team is not winning, you expect them to blame somebody. I wouldn't blame the coach. I think that if we really want to progress, particularly at this time, we have to keep him. Here is the time that we have the chance of defending the Globe Premier League title. We are lying third on the table, and with about 10 matches still to play, with a bit of 4 or 5 difference between us and the team that is leading. It will be, in my opinion, it will be wrong to sack the coach at this time. Even if we will sack him, we should wait for the season to end so that we will see how he will steer the team to that point. If we are unable to win the league and we think that the performance is that bad to get him out, then so be it. But for now, I think he should be maintained. And we should also look at the kind of quality we have. People have been talking about the fact that we sold players that we were supposed to keep, and in a way that also contributed to our performance in the entire competition.
Okay, away from that also, then there is this element of the coach being sacked, but is an issue, Jerome. I think we should learn how to handle our coaches and allow them to do their work. Don't you think so?
I think so, but we have a situation where club managers will not immediately come out to accept responsibility for whatever they might have done wrong. We've had Kotoko supporters, for instance, blaming the management for selling players, and I don't believe the Kotoko management will come out and accept that yes, we sold players and that also contributed to our exit. What we are all doing is to find somebody to blame, and I don't want to be in the shoes of Didi Dramani. Somebody called me yesterday and was even asking when the coach is going. That tells you that they really want him out. But from where I sit, I think it would be wrong to get him out at this stage.
Do you think Kotoko can defend the Globe Premier League?
My immediate answer is yes. But if I'm to reflect on how we've been playing, I think we will have to do so much work. I mean, we play good football, but the scoring is always a problem. Look at some of the chances that we wasted against Bejaya, and if that is how we are going to go, it will be very difficult to say we'll defend the title. But if we can improve from here, I don't see why we'll not be able to defend this title.
Obviously, you've turned your attention to the Globe Premier League and the MTN FA Cup. Looking at the MTN FA Cup and looking at the, teams who've qualified, we have a few number of them who are in the Premier League as well. You've played with them, but the Gold Stars and some of them that are coming through, you think Kotoko can match them?
Of course, but I do not want to think of those teams that have qualified now. We have to play Rainbow FC on Wednesday, and if we're able to qualify, then perhaps we can think of them. Now I would want to think of eliminating Rainbow FC before we even think about them. I think to an extent that is what we did in the Champions League. People were talking about playing Esperance when Bejaya, so we really have to take a game at a time. But I'm happy now we can focus on the local scene, because if we really want to get back to Africa, we must get things right here.
Okay, definitely get things right, Kumasi. Asante Kotoko yesterday failing to qualify to the round of 16 of the CAF Champions League. Well, let me quickly bring you the teams from and the countries also that they represent that have qualified in the CAF Champions League so far. I have the table for you, the teams that have qualified in this season's round of 16 CAF Champions League. There you have it: Zamalek of Egypt, Al Ahly of Egypt, GSM here yesterday edging out Kumasi Asante Kotoko, ES Setif of Algeria, Esperance de Tunis of Tunisia, Bizetin of Tunisia, and FUS Rabat of Morocco. So those are the North African teams. And Orlando Pirates from South Africa, TP Mazembe DR Congo, Leopards de Lycée of Congo, and Recreativo Libolo of Angola, while Ketos also there from Asiwe of Ivory Coast. We have Cotton Sports of Cameroon and Nugu Rangers of Nigeria, all qualifying to the round of 16 of the CAF Champions League. Also, Jerome, I saw you shaking your head looking at some of the teams there.
I was shaking my head because these are not teams Kotoko cannot play. But the truth is that we don't have the quality to match them, and that's why we are out. I have been one of those who believed that selling players wasn't a big deal. If indeed you cannot pay them, you have to allow them to go. But I think it is time we have a rethink of that, because this morning I was counting the number of players we sold, and we are about 5 or 6. And if you can get those quality players out of your team and still expect to compete in Africa competitively, it is always going to be difficult. We don't have anyone to blame. We have to blame ourselves. Just come back, re-strategize, and if we are able to win either the FA Cup or the Globe Premier League, I'm sure next year we'll be back.
Okay, obviously they will be back next year should they defend the title, that is the league, the Premier League title. And also we're bringing you some of the fixtures this weekend. Kumasi Asante Kotoko, they prepare on Wednesday as they take on Rainbow FC in the FA Cup, and also will be playing the Globe Premier League this weekend. So top action for Kumasi Asante Kotoko, hoping to bounce back again and defend the league as well as come back to Africa. Well, that's about way of sports here on Midday Live. My name is Joel Champo.